It's the 5th time junior doctors have staged a walkout this year in an ongoing dispute over pay and conditions. This time, strikes are set to last 4 days. The medics say they are not paid adequately, resulting in crippling staff shortages.
I was responsible for managing acutely unwell patients, sometimes by myself for a long time.
5, 6, 7, 8! The thing that really worries me is when we're short-staffed. I ended up doing the job of 2 doctors, but there's just one of me, and obviously that means you can't provide the level of care that you want to, and it's just not as safe as it should be.
I mean, there have already been unnecessary deaths.
The number of people waiting to start routine hospital treatment in England is 7.6 million people. That's a new record high. Of course, strikes do have an impact too. To date, almost 1 million appointments have been disrupted. This year marks the 75th birthday of the NHS, but these junior doctors argue there's literally nothing to celebrate. In fact, they're particularly worried about the future of the health service, especially if nothing changes. Outside University College London Hospital was Dorrit Young, who lost her daughter in 2021. She died at the hospital hours after admission, and Dorrit believes staff shortages contributed to her daughter's death.
I do know that the hospital was 50%, or that specific ward was 50% understaffed on that weekend. You miss things. Patient safety is just a really, really big issue now. It's a very dangerous, unsafe culture.
The NHS is operating with over 150,000 fewer full-time staff than it needs. The British Medical Association is now demanding a 35% pay rise in line with inflation.
The reason junior doctors are on strike is because our pay has fallen over 30% in the last 15 years. We've had 5 rounds of strike action now, and the government refused to meet us at the table with a credible offer. All we're asking for is our pay to be restored back to 2008 levels. We're not asking for a pay rise, we're asking for our pay to just be restored to what it was.
The government says no can do, considering it has already given a, quote, fair and reasonable pay rise of around 8.8%. But NHS trusts up and down the country say the health system is at breaking point and warn the staffing crisis could lead to more families like Gaia's suffering from arguably avoidable deaths.
Yes, she was the light of my life, and that's all gone.
Shadia, Edwards-Dashti, TRT World, London.